All right, we're all set to rock and roll. So I want to say good morning, everyone, and I'm going to do a little thing differently before our COVID-19 briefing because today's a special day, and I took this journey on in 2016, and we talked about how do you change the outcome of people's lives, and a lot of that goes into it with our equity agenda and everything else. But we started this, and I made it part of my signature move in 2016 at my state of the county, thinking how hard would it be to do this, to set up a mental health court in the county of Albany, so people would go in with that have issues with mental health wouldn't be sent to prison, incarcerated. Because one thing this country has down pat is incarcerating people. I mean, for really having 330 million Americans in this country, we have the highest incarceration of any place in the world. And think about it. I've said this before. India is 1.6 billion people. China's 1.4, somewhere in there. Russia's up there. And here we are with the most amount of people. So we've been successful in this country putting people in jail. Well, it hasn't worked. And we have to look at things differently. And it takes a partnership across the board to make things happen. And that's why I'm joined virtually by Judge Mendelson and my Deputy County Executive Dan Lynch to the left of me, Mental Health Director Dr. Giordano, our Public Defender Judge Herrick, our Probation Director Bill Connors, who's here in the audience. And again, it's taking 5 years to get to this point, but I am so excited. Today we're announcing the 3rd Judicial District has its first mental health court ever. And it brings me to the point where I was part of, with many other people, when we did the first domestic violence court in the city of Albany many, many years ago. And I remember all the meetings and at the table and the people that wanted it, the people that were fighting it, the people that didn't believe in that domestic violence court. And it was the same thing with the mental health court for 5 years. And it took a long time. And this is going to be a specialized part within the Albany City Court that will focus on low-level, nonviolent offenders living with mental health issues. Many individuals who go through the criminal justice system do not do it because they're bad people, but rather because they have mental illness. And one thing I realized when I was a city fireman, and I did that career for 20 years, a lot of the people that we had EMS calls with had mental health issues. And guess what? They weren't taking their medication. They either got the medication given to them, they ran out, never got it refilled, or they just didn't stay on top of it, which was a major issue. And that's another thing I'll be addressing my state of the county with a partnership with the Department of Health, but that's not next week, I think, or week after that. But there's so many steps that go into this in the criminal justice system. When you see how many cops pick up the same person and incarcerate them because they're not taking their medication, they're walking on the streets. When you see people out, there's issues that they have. And if we learned anything these last almost 12 months with COVID-19, is that people's mental health is affected. Even if you didn't have issues with mental health, some people have issues dealing with the new world that we're living in. And that is the same thing with kids and everyone else. Now imagine people that have mental health issues that haven't been addressed these last 12 years. So this is going to have a huge impact on treating mental illness that's going untreated now and going forward, that they're not going to end up in jail. They're going to end up in rehabilitation, counseling, different services that are going to help them, halfway houses, that are going to help them recover and help them understand how they got to take their medication to go through life and to make sure that they are getting help in the care that they need. So I just want to say this, something we've seen time and time again all over the U.S. Studies have shown that well over half of adults, even as high as 56%, are living with some type of mental illness that goes untreated. But many don't even know they need to get help. So one of the things we're going to be accessing is our health care. Many unfortunately slip through the cracks. So this is a huge initiative for my equity agenda that I've started a long time ago. And to sit there and to say that we're here, this is huge. So the mental health illness should not be criminalized. Instead, we're going to divert defendants into treatment that they need, alternatives to incarceration, make the community safer by helping those get the treatment they need to stop them from reoffending. And some of the people I want to thank so much is Judge Tom Breslin. Judge Breslin signed up on this in 2016, and we made this a mission before he retired to get it done. Judge Breslin, thank you. Hopefully you're watching this. I know you want to jump on. I know you retired, but his passion behind this, Judge Breslin made sure this happened. And to the judges, I mean, I can go back a couple years, and Judge Trexler, the other judges that were there, and I don't want to leave any of them out, kept calling me. They wanted this mental health court. They seen how this is going to have an effect. And to OCA, I can't thank OCA enough for making sure that they knew the benefit this was going to have to the 3rd District. They knew the benefit this is going to have to Albany County, and to look at things different. Now you got raise the age, you got no bail bond. There's a lot of steps we're taking to change a system that needed an overhaul. And this is just another tool in the arsenal that's going to get us there. And it's, again, not possible without OCA. So I do want to thank Judge Mendelson for being here on Zoom. And Judge, please take as much time and say whatever you want. Thank you, thank you, thank you, thank you.
Good morning. It is my deep pleasure to be here with you today and join you all in celebrating the opening of the first mental health court in the 3rd Judicial District, the Albany Alternative and Treatment Court. What a remarkable moment this is. I hope you can feel my excitement. There are so many people who have worked tremendously hard for a very long time to plan this very special court. I will begin with thanks to our judges. First, I offer my hearty thanks to our local leader, Administrative Judge Gerald Connolly, and our beloved former Administrative Judge Tom Breslin, as well as to the Honorable John Riley. Next, I offer my sincere and deep appreciation to the Albany County Executive, Daniel McCoy, and also to Dr. Stephen Giordano, who is the director of Albany County's Department of Mental Health. Without your steadfast support and your remarkable leadership, we would not be here today. Next, I do thank the Albany County District Attorney, David Soers, and the Albany County Public Defender, the Honorable Stephen W. Herrick. True success in any problem-solving court is predicated upon collaboration and support from the leaders and participants in our legal advocacy community. So I thank you all for your dedication and your perseverance. It has been a journey to reach this point. In March of 2002, the first mental health court in New York State opened in Brooklyn with just a handful of participants. A newspaper article marking the event in the Brooklyn Eagle noted that its planners expect the program to grow in the future. Well, I don't think the planners could have ever envisioned that almost 20 years later, New York State would have 31 mental health courts, with 4 more today in planning stages. As of January of this year, these specialized courts have enrolled close to 12,000 participants, and of these, more than 6,000 have successfully completed our mental health court programs. They leave with the tools they need to take care of themselves, support their families, and meaningfully contribute to our communities. Historically, justice-involved individuals who had mental illness faced making one of 2 choices in court: to plead guilty or go to trial. And because of their illnesses and their associated risk factors, either of these choices frequently resulted in longer terms of incarceration or harsher non-jail sentences than for others who are charged with similar offenses in the general population who don't have those issues of concern. Mental health courts provide a welcome third option: diversion to treatment. And every single day, mental health teams across the state of New York are identifying and assessing justice-involved individuals who have serious and persistent mental illnesses. And then they are linked to long-term treatment and services as a true alternative to incarceration. Utilizing principles of therapeutic jurisprudence, mental health courts achieve 2 separate but interrelated outcomes. They improve the psychiatric and social stability for the participants who are involved, and they improve public safety. I call that a win-win scenario. And as with all of New York's problem-solving courts, our mental health courts continue to seek new and creative approaches to seriously difficult cases in which social and legal problems coexist. So as the Albany Alternative and Treatment Court begins its operations, you will be seeing participants and families from every walk of life, every ethnicity, every race, and varied faith traditions. What they have in common is that they all seek relief from the stress of potential incarceration and the collateral consequences of criminal convictions. Those who are marginalized by mental illness and by poverty and by criminal behavior will look to this wonderful, beautiful new court you have all created, and they will be looking to you for help and for recognition of their human dignity. Please know, you're not alone in this work. My office and I personally am available to you to work with you and to support you and to help you in any way possible. Please don't hesitate to reach out to us. I look forward to hearing the many success stories that will be coming our way. Thank you.
Thank you, Judge. And I can't thank you for enough. I should just let you go off in the beginning because you said it perfectly, and this is long overdue. And thank you for your leadership too, and to everyone in OCA for getting behind this. And you are correct. There were so many partners in this, and we mentioned a lot of them. The District Attorney David Soares, everyone else that got involved in this. It took a lot of partnerships, and I learned one thing when we did the domestic violence court. Sometimes it takes a lot of education for people. And to understand we have to look at things differently. You got to take that step back, take a deep breath, and saying, hey, this isn't working. So let's try a new approach. And that approach was done with a lot of people at the table and a lot of education. But Dr. G, please.
Oh. Thank you, County Executive McCoy. Thank you, Judge Mendelson. Your energy did come through very clearly, and it is amazing that we have finally gotten to this important point. It has been a long road. I just wanted to say a couple of words. All across the nation, we are seeing too many individuals with mental illness that are involved in the criminal justice system. Our jails and our prisons have become what some have called de facto psychiatric hospitals. And I've said a number of times that the Los Angeles County Jail in Rikers Island and Cook County Jail in Chicago are the three leading largest psychiatric hospitals, de facto hospitals in the country, and that is just simply wrong. Albany County and the Department of Mental Health have long been committed to reducing the unnecessary contact of mentally ill individuals with the criminal justice system. We have a number of initiatives that we've been doing over the years on a continuum of services, from our 24 hours mobile crisis team to our law enforcement training in crisis intervention, our jail diversion efforts in the city court, our robust clinical team at our correctional facility, our reentry task force, all committed to trying to minimize the unnecessary involvement of people living with mental health challenges in the criminal justice system. But it was almost 5 years ago when County Executive McCoy said, you're missing a piece. And in retrospect, it was an obvious piece that was missing, and that was mental health court. And it has been a long road, and there have been many partners along the way, and I think they've been mentioned so far, but they have all contributed to this place that we've arrived at today. We're going to pilot this project. We have great optimism. Judge Riley is the presiding judge. He is very, very invested in this. Judge Breslin was a leader from the beginning, and the other partners that have been mentioned, Public Defender Herrick and Probation Director Connors, as well as the DA's office. This is very exciting for all of us, and I'm just so pleased to have been a part of it. And again, just want to say, it has been a long road, but we've arrived.
We have, and thank you to everyone. And again, I do want to thank my former Deputy Phil Calderon, who's now at the airport in aviation source history. So Phil, you probably love me every day when you go out there. But to my new deputy, Dan Lynch, who grabbed this topic and continued to work it on his end, for your leadership, Dan, for making sure we kept everyone, all the pieces of the puzzle together for this, and following through. It's been awesome. But Dan Lynch, please.
Good morning, everyone. You're probably wondering why I was here. So I'm just going to put some things from my perspective, my involvement with this wonderful initiative, and kind of walk you through the process a little bit. But before I do, I know that there's been many individuals that have been named for their partnership and cooperation through this process. And there's a couple that haven't been mentioned yet, and I wanted to just take a moment to. The OCA Office of Policy and Planning was a key piece and a key stakeholder. Beth Diebel and Christy Bass, Tony Mancino from OCA, thank you. This does go back 5 years. Judges Trexler, Stiglmeyer, and now Riley from the Albany court system. I believe Judge Carter was involved early on. Our Office of Indigent Legal Services, our Office of the Alternate Public Defender, and the Center for Court Innovation. So as you could tell, with all those that have previously been mentioned in the list, those that I just added to the list, there are several key components and partners in this. And you can't just turn the switch on and expect it to be up and running in a matter of weeks. So that brings me to my perspective. And I got to see some of the need demonstrated from my time spent as a prosecutor with the Albany County DA's office. Spent approximately 13 plus years in that office, and several of them in Albany Police Court. And there was daily notice of the need to treat and have alternatives and diversions for individuals who suffered with mental illness. And at that time, when I was practicing in that court, there were not these diversion opportunities. And we worked hard in trying to advocate for that. And fast forward a little bit, in 2016, as I became the county's attorney, I was tasked very quickly within that role of being the liaison here and getting this court up and operational. Well, it took 5 years, county executive, but we're here, so I did deliver on my promise to you. But like I said, it's not as easy as turning a switch on. So the need is there. When Dr. Giordano and the other partners named sat around the table and asked if there was a demonstrated need for such a court, it was, so recognizable that there is a void within the court system and a true need to fill in the gaps. At that time, when we started our planning, there were 29 mental health diversion courts within the state, and none of them had been created after 2010. In listening to Judge Mendelson's comments this morning, I was happy to hear that there was a few additional and even more in the process of getting up and running. So the need is there. The professionals that will be involved in this diversion program they are professionals. They will provide a level of service and outreach to individuals who need it. And we all have to be really grateful and thankful that we were collectively able to work together to get that opportunity, present that opportunity for our residents. So I am so thrilled beyond belief to see all the partners here today that I know we spent many, many hours on the phone, around the table, trying to work through this process, and to see it become a reality is really exciting for me. County Executive, you had the vision 5 years ago. Judge Breslin, as you mentioned, has been a key partner throughout this all, and we certainly wish him all well in his retirement.
Yeah.
And he's missed. But Judge Connolly has been terrific in picking up the ball. And I want to thank Judge Connolly for continuing that vision, continuing our vision here in the county, and making this a reality. So thank you, everyone.
Thank you, Dan. And again, to everyone that was involved, there were so many people, and I could go back to Majority Leader then, Frank Camiso, and Sean Ward, and Sean Morris, who was then chair, that we were going through this process, and to Andrew Joyce for staying in partnership with me on all this stuff, and and to the mayor's office for letting us house us in the city of Albany. So it does take a variety of people to come together, and I do want to say to Judge Breslin, thank you, thank you, thank you to everyone that signed off on this. Thank you, and for what this is going to be for people with mental health issues. It's going to be a game changer. Yes, unfortunately, people still will fall through the cracks. Yes, we're not going to be able to help everyone, but if we continue to change the criminal justice system, which has been a signature move of my administration, we will go in the right direction, and and we will get there. But again, Judge Medelson, thank you. So good morning, everybody, and thank you for being patient. We had some exciting news, and now we're going to move forward to the world that we've all been living in, COVID-19. But since we held our press conference on Monday, 6 more Albany County residents passed away from COVID-19. We have 321 more positive cases report in the county, and it's oh no, I said that wrong. Positive case, yeah, 321 positive since then. So, today marks 351 days, week 50. We're, very close to hitting the year anniversary, which, again, I never thought we'd be sitting here, Dr. Whalen and I, a year later and dealing with this. And unfortunately, this is what we're going to be in for the next couple of months. I said it early on, and I got criticized. I figured September, October, we'd be getting out of this. I know people don't want to hear that, but to be mentally prepared, and that's what we talked about earlier on different things, it's good to realize the world that we're living in. But sadly, we had 3 more Albany County residents pass away last night to COVID-19. My prayers and my condolences go to the families, to all the families, because that marks 351 since this all started almost a year ago. In the beginning, I remember people couldn't say goodbye. They couldn't have a wake. They couldn't have a funeral. It's still limited how they can do it. And it's tough. It's hard enough to say goodbye to anyone when you lose a loved one, but it's tougher when you can't send them off the way that you want to send your loved one off. So please take a moment and think about that, and think about the 500,000 people that have lost their lives to COVID-19. As of today, Albany County has 20,351 cases of COVID-19 in Albany County to date. 77 new positive cases since yesterday. Our 5-day average is 75.8. Yesterday it was 73.8, so we've gone up a little bit. There are currently 1,441 people under mandatory quarantine. Yesterday it was 1,407. As of the positive cases, 26 had close contact to a positive case, 7 are healthcare workers, and 44 don't have a clear source of infection at this time. As of today, 63,653 people have completed quarantine. Big number. 19,750 tested positive for the virus and had recovered. That's an increase of 57 recoveries since yesterday. There were 3 new hospitalizations overnight, 48 people currently in the hospital, and yesterday the number was 53. There are 6 patients currently in the ICU. Yesterday there was 8. Albany County 7-day average for percent positive rate is 1.8. Awesome. And the capital region is at 1.9. So we are sadly still staying in the right direction and going down, which is good. But we still need everyone to continue to do the right thing, to please continue to wear a mask, stay 6 feet apart, cough into your arm, clean your hands, and we're getting through this. But it's not time for COVID fatigue. It's not time to start taking the mask off. It's not. I think Dr. Whalen should give another demonstration, and I say it with a smile because I think people are forgetting how to wear their mask, and I've been seeing more people lately with it under their nose, and I'm like, come on, pull it up, pull the mask up. So again, please, we're getting through this. For those who want to get vaccinated, check their eligibility. Please call 1-833-697-4829, as always. In our partnership with the United Way, 211, Pete Gannon, to the United Way people, thank you. It's been a godsend for people that we said can't get on the internet, don't know how to navigate the internet, or don't want to call 1-833-697-4829. Thank you to Pete. Is it perfect? No, nothing's perfect. but we are trying. We are adapting to what's going on and trying to give people a better positive experience. So to the United Way and the leadership of the team there, not just Pete, to everyone that works there, thank you so much. As a reminder, we did launch our pre-register tool to get people signed up, so it makes it easier. And to contact them, we have a vaccine clinic with Mohawk is going on out for our deliveries of different things. We had the follow-up from 4 weeks ago with the second dose. That partnership's going well, so I want to thank Mayor Sheehan and Mohawk Ambulance and everyone that was involved for making that happen. Thank you. We'll continue to announce exciting things with Mohawk going forward into the future. So Albany County's website, you can go there, www.albanycounty.com, and you can see the different requirements, if you're eligible, what sites you can go to get tested for COVID-19, and different things going on in the wait time. So please. But the exciting news, and some of the stuff that I take it as exciting, I guess, getting a shot and vaccine in people's arms, exciting because it is. It means we're getting back to the way things used to be. But as of Wednesday, after our rescheduled vaccine clinic at the Times Union Center, Albany County has administered 4,335 first doses. Let me say that again, 4,335 first doses. 1,678 second doses, which is good. That also includes the 400 doses that we've given to the Center for the Disabled and that great partnership that they're going to model across the state. To Dr. Whalen and her team, thank you. Great initiative, great idea. Dr. McKenna came in with extra vaccine from Albany Med, but to Dr. Whalen and her team for identifying that and for individuals that can't get out to the Times Union and other places, so thank you. It does not include Mohawk Ambulance through our partnership with them, the vaccine that they've been getting out, so thank you for that. We are also anticipating 1,000 more first doses and 800 more second doses at our last night's pod, so which is awesome. This includes the 1,000 doses yesterday, but I walked through, and Dr. Whalen, thank you, and we walked through with Chairman Joyce and my deputy Dan Lynch and the legislature. Dennis Feeney was supposed to be there, and Frank Marinello, to just thank the workers and the volunteers, the medical corps, to everyone that's there doing their job. Thank you. And Chairman Joyce had proclamations, and it was nice. It was nice of the legislature to thank everyone there. But it's nice to let them see the operation that Dr. Whalen and her team, I should say commander, she had that vest on, commander. So she did get salute from Major Joyce, gave her a salute, but it's nice. And hearing people's stories get you emotional, and people thanking us and telling us how smooth the operation went, to have that amount of people go through. And yes, there's going to be some bumps in the roads, and I know some people will be aggravated, but when you have over 95% of the people go through there and they're literally almost crying and they want to hug you, and I'm like, I'm a hugger, so I'm like, yeah, I got to remember, COVID world, we can't hug. But I got to see Laura and Greco, and I just want to remind you about her. She was the stage 4 lung cancer, wasn't able to get a vaccine. Chris Churchill did a great story on her in the Times Union. It moved me to almost tears, and yeah, you can have fun and laugh at me. It was emotional to read for a variety of levels, not just for Laura, but for people like her with underlying health issues, who this has been devastating the most. And yet, we left them out. We talked about Uber drivers and Lyft, and I'm not trying to compare the two. I'm not saying they're not more important, but we had a category of people we need to touch. And when I read that story, it broke me down. And I think of my sister-in-law with ALS that I still cannot get a shot to, that I can still not get someone there. It breaks your heart. And I saw her in line. Well, she saw me, and she grabbed me, and she was in line, and she goes, "Hey, I'm Laura Greco," and she goes, "I prayed to God all day I was going to see you, and I was going to get to see you and thank you, and I can't believe this got done." And I was there with Dr. Whalen and my deputy Dan Lynch, and it was so moving. And I go, you know what? I was having a terrible day. It was a rough day yesterday, and because you made it. I said, I'm going home on this high note, because it was like, just to see her face, to hear her story, and the stories of everyone that was in that line, that have been scared because of the underlying health issues. To Dr. Whalen and everyone, thank you. I'm not going to tear up, but I just want to say thank you. And to Chris Churchill and Times Union, you can move a story. To the press out there, you can move that needle. People, anyone can. So if you think you can't make a difference, you can. You just got to be willing to push the envelope and not back down. It was kind of like the mental health court and other things. But to Laura, thank you. Thank you, and hopefully we start to address the people that are homebound, that can't get out. And I was just talking to Dr. Whalen about this. We have it set up with Mohawk and other people and providers and Cohoes firemen. I want to say to the Cohoes Fire Department, the president, and your name's escaping me, they got certified to give vaccines. I helped out John McDonald, and they're willing to do Cohoes and seniors that are home and they have identified. These are the partnerships we need. Colony EMS. Albany Fire Department's supposed to be getting on board, and that was the reason why I partnered with Mayor Sheehan to give shots to people that can't get out and help us help them. And the reason they might not get out, but their aides get out. The people that come and give them services every day have to be around them, so they are exposed, and this is affecting them. So hopefully we get it right as we continue to move forward. And try to be patient. But again, to Laura, thank you. It was great. I'm sorry I carried on more than I should have, but I have to tell you, it did really make my night all night to see her there, and knowing that sometimes we can do good through everything to get something done for people. So again, I also want to highlight our pre-registration tool that we've had over 25,000 people sign up for, 19,000 are Albany County residents. Bear with us. I have to tell you, and I don't want to speak for Dr. Whalen, it overwhelmed us. It was a lot more people pre-registering that I imagined or envisioned. My deputy was joking around with me, and my counselor, Jeff Jameson, saying, what did you think was going to happen? And I'm like, I don't know. I just thought a couple hundred people, maybe 1,000 would sign up, not 25,000. So it really shows the need for what we did. I'm encouraging the state of New York to do the same thing. We have multiple people pulling from there. So if you sign, it's Whitney Young's pulling from there. The Washington Army will be pulling from there, which we made an announcement yesterday. Other organizations are taking from there. But we're still saying, look, it's going to take time. 25,000 is a lot of people to get to when we're trying to fill the pods. Give us time. But I will encourage you to still continue, if you don't want to wait, is to continue to look for your vaccine, especially when Washington Army opens up, because they're going to be doing 1,000 a day. That's going to be a lot of slots open. So again, please bear with us on that. But I also want to say 19,000 of those from Albany County were using the hybrid model, which means we're using the pre-registration list, and that people can register 2 days in advance of a pod for a vaccine for clinics. So that's important. And again, I do want to say to Dr. Whalen and her team, and I'll say this to the media, please take an opportunity, walk through the Times Union Center when we're doing the pod. Just check with her, because she'll throw you out if you're not supposed to be doing there, if you're getting in the way of people. She keeps it going, and she pushed us along if we got in the way, and which she was doing her job. But you should come down there and see the great work that they're doing, and the experience and the smiles on people's faces. But Dr. Whalen.
Good morning, and thank you, County Executive McCoy. I, in particular, would like to thank you and Chairman Joyce for coming down to the pod yesterday. It really meant a lot to recognize the Medical Reserve Corps. We have an abundance of people that come and assist us every week in a volunteer capacity. These are health professionals and others that give of their own time to come down and assist us with the very Herculean task of vaccinating thousands of people. Yesterday was about 1,600 people were vaccinated, and we can't do this alone. And your time means the world to us. So to come down, and for Chairman Joyce to, in particular, take the opportunity to provide certificates to our Medical Reserve Corps, to award them with, a recognition for the work they do, is, a great opportunity for all of them. They were very pleased. Unfortunately, when Chairman Joyce came down, we were still in the midst of, and the county executive, we were still in the midst of vaccination. We were not able to interrupt our operations to take a moment to thank everybody, but I did share with them the good news afterwards, and there was a giant round of applause throughout the TU Center when we concluded our clinic last night. It's an amazing group of people, and I want to thank each and every one of them. In particular, I want to thank Tricia Bellato, who's our preparedness director, who is coordinating these efforts, along with myself and Deputy Commissioner Mary Beth Miller. It is time intensive. It is a 7-day-a-week job, but you know what? We are not tired. After all these months doing this, we are now invigorated because we know that we are tasked with moving things forward to get us to the end of this. It has been a very, very tough year. It's been a tough year for those of us working in the health department. It's been a tough year for everyone, whether we're talking about business owners, whether we're talking about families, whether we're talking about hospital and healthcare workers, whether we're talking about kids in schools. It has been a tough year for all of us, and we are all working as hard as we can to make sure that we can advance the vaccine to get us all to the point of herd immunity when we can start to resume what all of us have been looking forward to for so long. So the support of our Medical Reserve Corps is just incredible. And, you know, people do come through with great stories, with great appreciation. And it's I have to say, very rewarding. I feel very lucky to be part of this team and part of this effort. And moments like yesterday, when you ran into Laura, that was completely organic, and I can attest to that. We were standing and chatting, and literally you turned around and she was there in the line at the same time, just completely by chance. That was a pretty special thing. So we're very grateful to be able to continue to do this. I know last week everyone's aware we had some disruptions because of the weather-related delays. We will be hosting another pod this coming Monday. And so if you go to our website, there will be opportunity to sign up for that. As the county executive indicated, we really want to utilize the list to sign people up for the pods. And we are looking at developing a process where hopefully we can wrap around when somebody signs up, we'll be able to automate an appointment for them. We're almost there. So at this point, we still have to have, it's time intensive to call down the entire list. So we're going to get through a good portion of the list for Monday, but we are also going to be posting a link that people can sign up for. So if you go to our website at 5 p.m. today, the link for Monday will be released. Again, this is for those that are in the 1B essential worker population and those with comorbidities. And the comorbidities and the 1B essential worker population is listed on our website. So you can go and check your availability. Please do not sign up if you are not eligible. We do have staff that greets you and checks your eligibility when you come in. Also, it's important.
I don't mean, can you explain that? Because I get that question all the time. What do they need for underlying health issues? They just need a note from their doctors, or what is a requirement when they come through your pod?
Right. So when you come to the pod, you can either bring with you a note from your physician that you have a qualifying health condition, or you can provide us with an attestation. And sign that you have a health condition that is listed as part of the comorbid conditions. And so that is what we are currently doing. And, we encourage people to come down. I think opening up to comorbidities has really allowed us to see a lot more people that would be adversely affected. I want to clarify as well that if you are over 65, if you have a comorbid condition that's on that list, we can vaccinate you at our clinic. So it's not age dependent, it is comorbidity dependent. So all of those are clearly listed on our website. In addition, when you go on the website, I had a couple of people tell me this week, and we'll make sure it's clear, that they booked into the pre-registration and thought they were getting an appointment at the clinic. If you are, we urge everybody to enter that pre-registration information. That's important. But the way you know you've registered for the clinic is that you get an appointment. You get an appointment at that time. So make sure, if you're going on today at 5, that you are utilizing the link that will give you an appointment. If the link says to you, well, we'll get back to you with an appointment, then you're on the pre-registration list. So, this will be evolving going forward. It is a large task that many of us are working on together to try to streamline a system so that we can get people signed up that need the vaccine, so that we are able to provide multiple opportunities for people to be able to get the vaccine or to be able to schedule their vaccine. And I think that, we're looking at hearing from the state that this is going to be opening up in the coming weeks. So this is great news. This means that additional partners in the community, such as pharmacies and others, will be receiving vaccines. And there is a hope that practices will also be receiving vaccines. A lot of people say to me, well, why can't we just get it at our doctor's office like flu shots? And, I want to say that this is not a flu shot. It can't be stored like a flu shot. It has to be, it is strictly regulated by the state that, we find out about our allocation usually on a Sunday, and we have to get this vaccine into arms within a week. That is not always practical for some providers. Many are ready to do it. Also, once you pierce a vial, you have to give every dose within that vial in a day. So this sometimes creates practical considerations that are difficult for practices. But we know a lot of practices are ready to do this, and we're willing and ready as the vaccine supply starts to increase to be able to increase the opportunities within the community and have people vaccinated where they feel comfortable and safe getting vaccinated. So I'm excited about increased opportunities and about opening up of supply going forward, and we look forward to continuing this effort. I know it's been discussed earlier this week that we have had 3 cases of the B.1.1.7 variant, which is the UK variant, identified within the county thus far. The first 2, I know I reported at a previous press conference, was at a congregate youth setting. I am happy to report that all follow-up testing at that facility was negative. So that's good news. The state continues to test for this variant, and again, as we've referenced, the concern going forward is that this may emerge as a predominant strain going into March. Why is this important? We don't think that this particular strain causes a worsening of clinical disease, but we do think, and we do know, that it is much more communicable. So this is, again, we don't want people to be carried away in the hope of coming towards the end of this and lose track of the importance of wearing your mask. And, the CDC has talked a lot about wearing double masks. I am double masked today, and that is the practice on that is to wear a surgical mask and a cloth mask on top. Again, it is essential that you cover your nose and your mouth when you are wearing a mask or you are not masked. So we continue to urge the public to wear masks when you are out and about, to continue to hand sanitize, and to continue to avoid large gatherings, especially when we know there's a communicable variant. I would add additionally, college students are coming back, and it's important that we continue to stress upon them the importance of infection control. That is a population that we know likes to socialize and likes to congregate, and we want to get you there, but we're not there yet. So please continue to utilize the behaviors that we've talked about. The numbers are continuing to decrease, and we're hopeful about that, but again, we do remain cautious that there could be an uptick in March related to the highly contagious strain. Other than that, we continue to do case investigations at the health department. We have staff working 7 days a week, and look forward to continuing our efforts with increasing vaccination in Albany County.
Thank you, Dr. Whalen, as always, to you and your team. And look, Johnson & Johnson's getting through pretty quick through the FDA, and that's only one shot. And once that starts getting out, will be a game changer, and you'll see more of these pods popping up. And we'll be begging for people to come get shots because we'll run out of arms to give the vaccine to, which will be a good problem to have. But as we improve and we stabilize, the economy starts to open up, guidelines are coming out. I'll say this again. I know the governor announces it, and then we have to wait for the guidelines to come. And, then we have to siphon through that. And it was kind of like with the basketball. It was good for kids in school, K through 12, but not AAU and everything outside of that. So that was something that we didn't see in the beginning, but Dr. Whalen's team did put the memos out and let people know what it affects. But pool halls can now reopen March 5th as long as specific rules for mask wearing and social distancing are taking part. We also got guidance for smaller businesses that offer alcohol and throwing axes. So I do want to say to Chris Churchill, another story that opened it up that for whatever reason the SLA was picking on them. And that's all straightened out now too. There'll be restrictions of 50% maximum capacity, so you have to continue to look at this. I was disappointed to see the finalization for the state guidance for nursing home, because what happens is when they have a press conference and they put it out there and they say nursing homes open up Friday, that's all everyone hears. Well, where Dr. Whalen and my team got to sit there and go, okay, what's the guidance? And when you get the guidance, people don't want to hear the guidance. They just heard that nursing homes are opened up this Friday, which I was excited to because people want to see their loved ones. People want to get in there. But our Department of Health continues to work the guidance to for the guidance for nursing homes to open up. And some of the problems that we're having is if there's under the CDC guidelines, and we still have to follow it, is that if there's someone with COVID-19, whether it's a resident or a worker has a test, we're shut down for 14 days. We can't open up. So you can imagine the amount of workers and residents that do test positive every now and then. Under that, we won't be open up for a while, unfortunately. What they have allowed, though, is people that are moving in their loved ones for the first time, that they can go into the nursing homes and help them adjust. To the caregivers, certain caregivers can go in and help out with their loved ones. So there is some guidelines and some flexibility now that we didn't have, or someone that's passing away that has their full, a couple days left or a couple weeks. Now we can let the families in to properly try to say goodbye to their loved one. So there is some light at the end of the tunnel. But to the people with loved ones in nursing homes, you got to be patient. These are our guidelines. We got to live by them. I know, we had it worked out where 25% could come in at different times, and they worked it all out. But when the guidelines came out, if we do have a COVID-19 at our nursing home, we will not be allowed to let that 25% in. So please keep that in mind as you go forward and work with us. And, as we continue to move forward to get through this. Our County Department of Health continues to work with guidelines to allow weddings to move forward as of March 15th. And I talked about the nursing home stuff. So this will likely affect fewer people being able to visit loved ones. But again, it's disappointing. We'll get through it. We've been through it and we'll continue to get through it. So I also want to remind people too, we're receiving a lot of calls on the landlord funding that we received, the $9 million. I want to say it's probably been a good month now. We're still waiting on guidance from the federal government. So once we get that guidance, we will put it out there. And, I know Mike Heim from the state has been working on stuff too, because not only did Albany County get $9 million, the state of New York got like $380 million somewhere in that neighborhood. It might even be more than that for other smaller counties, because you had to be over 300,000 to apply for the money. Any county under 300,000 has to go through the state. So again, be patient with us. We're just waiting for the guidance to come out, and as that comes out, we'll get it out to everyone. I know people are looking for relief. I know the landlords are looking for relief that own these places that haven't gotten rent in over a year now. As always, please, mental health support is available 7 days a week. 8 a.m. to 5, 518-269-6634. Our 24-hour sexual assault hotline number, 518-447-7716. And as always, the United Way in-state hotline. Again, thank you to everyone that makes everything happen. Please stay safe